tie-breaking vote. Then it goes back to the House in a House Senate Conference Committee, having stripped out all of the stuff that was the last-minute deals that the House Republicans threw into this bill to get it passed in the House. So all that stuff is stripped out now if it comes back to the House, and now they've got to vote on it and approve it for it then to get reconciled and then go to Trump for a signature. So I have some serious questions about whether or not...
So Obamacare seems to be slowly dying on the vine in the era of reduced choices of health plans and increasing premiums. Is that what we're just going to see? It slowly die on the vine over the next year or two until it gets bad enough that people figure out they better compromise?
I think they'd come to that realization pretty quickly if they can't pass something that would shore up changes.
Nope.
I think the Democrats have actually done a pretty good job about talking about Republican sabotage here, and that's what's really led to this dying on the vine. There's a lot of evidence of that, and it continues with just this pall of uncertainty, Gene, over the market. I mean, remember, here we are in mid-May. Most of these health plans have to submit their bids for these exchanges right about now or into the next couple of weeks. And they've got this black cloud hanging over the side. The government's going to pay these subsidies, whether or not it's going to be a repeal. And so all of that impacts the way these products look in the marketplace. And I think they're unable to pass what came out of the House or anything like it. Then there's going to be a real reckoning here that says, okay, now it's time to repair Obamacare rather than repeal and replace it.
Yeah. If I was a medical director at one of those plans facing that uncertainty, I wouldn't be pulling out my hair because I don't have that much left, but I would be distressed. Before you go, John, anything I should have asked about but didn't? Anything that our listeners ought to pay attention to?
Look, in the Senate, it's the upper chamber, it's the deliberative body. I think we've really got to see whether or not there's going to be any air under the Capitol dome with this cloud over the White House right now with Trump and firing Comey and leaks to the Russians and possible obstruction of justice. And this week, I'm just starting to hear Republicans utter the word impeachment.
Yeah,
and
I heard it this morning, too.
When this dynamic starts, and when they're talking about a bill that's historically unpopular with the American public, it really does raise the question as to whether or not Trump's entire agenda is now in question, not just health reform, but tax reform and possibly even his ability to finish his term of office. It really is a very uncertain time here in D.C. right now.
How does President Pence sound to you right now?
Marginally better in that he wouldn't tweet us into a war with North Korea.
Okay.
From an ideological standpoint, let's not forget that this is a guy who still thinks you can talk gay people out of being gay. So, I mean, I don't know that we see...
Well, I think he says that from personal experience.
Well, I don't know. But, and then, of course, the thing you got to worry about with Pence is whether his wife would allow him to be alone in a room with somebody like Angela Merkel. So, I think it's an improvement in temperament, but not in policy or positions.
Well, thanks for calling into Grumpy Old Doc. More about John's insights can be found at www.gormanhealthgroup.com, GormanHealthgroup.com, or Facebook at Gorman Health. Till next time, stay healthy, my friends.
Be sure and subscribe to our podcast on iTunes and more details at grumpyolddoc.com.